Thank you so much for joining us today for a discussion on the gender differences in ADHD. My name is DiPietro. I am a licensed clinical social worker at the Child Mind Institute. I specialize in the diagnosis and treatment of children and adolescents with ADHD, disruptive behaviors, and anxiety. And I have a special focus in girls with ADHD.
And hi, I'm Meg Glick. I am also a social worker at the Child Mind Institute in the ADHD and Disruptive Behavior Disorder Center. I specialize as well in the diagnosis and treatment of ADHD, disruptive behavior disorders, and early childhood anxiety disorders. And today we are so excited to be talking with you about the gender differences in ADHD between boys and girls. Our real focus of today's discussion is to try to help viewers understand how to pick up on the signs and symptoms of ADHD in young children, particularly in girls, where we know that ADHD symptoms can present a little bit differently, so that we can get families and kids into treatment earlier and prevent some of the comorbidities that can develop over time.
So I think it's really important to remember here that we're talking in very general terms about ADHD, and we're talking about the gender norms that have developed over time through research and clinical practice. But ADHD is a very special disorder in that it affects a child in very different ways, and so some of the things that we're talking about today might sound very much like your child with ADHD. It might sound absolutely nothing like your child with ADHD.
Yeah, absolutely. And so what I want to break down for everybody now is really the differences in the presentations of ADHD across children. ADHD is a really large umbrella term that comes with a lot of myths and misconceptions about what it is and what it's not. And so we thought it would be helpful to really break down for everybody the different subtypes of ADHD so that you can understand how this might be presenting in your child a little bit differently. So ADHD,
how do you think we could kind of break that down?
Sure. So ADHD is a neurodevelopmental disorder that impacts really how the brain is developing and the functioning of kids across different settings, kids or adults. As adults, lots of adults can have ADHD also. The subtypes, so this is the piece that sometimes is a little bit misunderstood. ADHD can function as an inattentive type of ADHD, a hyperactive and impulsive type of ADHD, or something that's called a combined type, which is where a child or an adult has symptoms that meet criteria in both of those categories. So what I'm going to do now is really break down some of the symptoms that are common in those different types of ADHD. So the inattentive type symptoms that we see, these are often less noticed or less of the symptoms that people think about when they think about ADHD as a disorder. So these are symptoms like having difficulty staying organized, losing materials, distractibility, or what might look like daydreaming in a classroom, difficulty following instructions, mostly because you're thinking about something else and you miss the instruction to begin with. Those are symptoms that tend to be a bit less disruptive. They're more internal, and a child may go less noticed in a classroom environment or at home with these symptoms because they're causing a little bit less trouble. Hyperactive and impulsive type symptoms tend to be more of the symptoms that people think about when they think about ADHD. These are sort of the bigger, bolder, more present symptoms in a classroom. They are more disruptive in a classroom environment. They involve getting out of your seat, calling out or interrupting, having trouble at home, maybe having trouble staying seated during something like mealtime, or if a family is going out to a restaurant. Kids with the hyperactive and impulsive type of ADHD are often described by parents or teachers as on the go or driven by a motor, having a lot of difficulty reining in those impulses to move their bodies. So those are the different types. Anything you want to add to that?
No, I think that that's perfect. So ADHD is kind of like the umbrella term, if you think about it that way. We used to have something called ADD, which is really that inattentive subtype. ADD no longer exists in our kind of terminology. Now it's that umbrella term of ADHD, and then the three subtypes, if you will.
And I think that's such a good point because I know many families who come to us have either a parent's had a pre-existing diagnosis of ADD, or ADD has been described to them as something that they might be looking for. And so the ADHD terminology is a little bit confusing and a little bit newer.
Yeah, exactly. And so boys and girls are more likely to receive an ADHD-C, or that combined presentation, not diagnosis. But when we think about ADHD, people often think about it as really a boy's disorder, and they think about it as kind of more of that hyperactive, impulsive type. How do you think we can kind of conceptualize that?
Yeah, so it's a really good question. And what we know is that for children between the ages of 4 and 17, boys are 2 times more likely than girls to receive an ADHD diagnosis. A piece that Jill and I will be discussing today is that we don't actually believe that's because ADHD is more common in boys. It's really that the symptoms present in a way that boys' diagnoses are caught earlier. And so really what it is that girls get the diagnosis later in their lives, typically more towards high school years or even later into adulthood, when the symptoms start to become more impairing or more obvious, when they have more difficulty keeping up with a harder workload or difficulty navigating some of the more nuanced social interactions that happen as people grow up into adults.
Yeah, and I think it's important to note that the prevalence rate is higher for boys in childhood, yet as girls and boys mature, we actually see that prevalence rate is about a 1-to-1. So that ratio really kind of evens out into adulthood.
Yeah, absolutely. And so, like I said, a big piece of this is how the symptoms present differently. That's really why we think that, or really what we've seen in the research is what's causing this real divide in diagnosis in childhood. So Jill, can you talk a little bit about just what those symptoms look like in a different way in the classroom or at home and how parents can be thinking about that?
Definitely. So what we know is that teachers are actually the first ones to often talk about your child's lack of attention or lack of focus. And boys in the classroom tend to be much more hyperactive, impulsive. We tend to see boys with ADHD kind of hopping out of their seats, being more disruptive, and those behaviors and symptoms tend to get the attention of teachers much more quickly because simply it's much more disruptive to the other children in the classroom. Our girls, on the other hand, tend to be much more inattentive. They tend to actually be kind of like the daydreamers, twirling their hair, right, doodling. They tend to be kind of lost in their own thoughts. And what's happening here is both of these children are not receiving the education that they need. They're really not doing their job and functioning in a classroom. However, boys' symptoms tend to get identified much more quickly, and therefore they tend to receive that treatment that they need, whereas girls tend to go undiagnosed and
If I'm
missed.
daydreaming, I'm not really bothering anyone. Whereas if I'm jumping out of my seat, I'm calling out, I'm using more inappropriate types of language, which are common symptoms that we might see in our boys. That's more obvious, right? That causes more of a problem in the classroom.
Exactly, yes. Exactly. We also tend to see girls overcompensate for their symptoms of ADHD. And I think we were just talking about a really good example of this.
I've had several parents recently give me this example, and I think it really stands out in terms of what we mean when we say overcompensate for the symptoms. So like I went over, one of the symptoms of ADHD, particularly that inattentive type, is forgetting materials, losing things, having difficulty remembering to put things back where they belong. And so I've recently heard a lot of parents of girls sharing that their girls who maybe are expected to have a water bottle in the classroom have decided that they're just going to not drink water all day. They're going to leave the water bottle in their backpack because I know I'm going to lose it. So what's the point of taking it out if I know I'm going to lose it? So I just won't drink water. We know, right? That's not a very healthy outcome, but it's a way that girls are overcompensating for their symptoms so that they can present like everything is fine. When really what we know is they go home and things are not really fine. They're not feeling like they're doing as well as their peers.
Exactly. We also see girls in the classroom as more hyper-talkative or verbally impulsive. This can often have a negative social impact, which we'll get into in a few minutes, but it's important to think about. And when we do see that kind of classic hyperactivity with girls with ADHD, we see it more as fidgeting, doodling, kind of wiggling around in their seat, right, unable to kind of sit still, rather than the boys that we see, where we see kind of that hyperactivity in more of a classic way, getting up out of their seat, running out of the classroom, climbing, jumping, all of those symptoms. We see for both genders a hyperreactivity, meaning that they might have really big emotions for really small problems, and they have difficulty regulating their emotions. Impulsive girls tend to struggle socially. Again, we'll talk more about that, but it's a lot of that kind of verbal impulsivity that we see, calling out of term, jumping into conversations in an inappropriate way. But ultimately, when boys look the part, when they look like they have ADHD, they're much more likely to receive, again, that diagnosis that would lead to treatment. And unfortunately, our girls are just getting missed in the classroom when educators don't know what to look out for.
And also those symptoms socially present differently as well. So boys with ADHD might have some difficulty in social interactions. I think first we always want to back up and say that our kids with ADHD have a lot of social strengths that are really important to recognize. They tend to be extremely socially motivated and really children who other kids are drawn to in a classroom environment.
Yeah, they tend to be charming, social, fun. So sometimes we don't see any social difficulties with kids with ADHD.
So certainly it's not the case for all kids that we would have some of these social difficulties along with ADHD, but for some kids, their ADHD symptoms do get in the way of how they're able to navigate pretty typical social interactions. For boys, what that can look like is that hyperreactivity. So when they're in an interaction with a peer, they might make friends very quickly, and then interactions quickly go south. They have a conversation where it doesn't go well, and their response is to get into an argument, say that they never want to be friends with that person again, use more inappropriate language or name calling, and that can often lead to lost friendships over time. Girls, it looks a little bit more nuanced and a little bit different.
Yeah, exactly. So with girls, we tend to see, again, that kind of hyper-talkative behavior, verbal impulsivity. They tend to jump into conversations at inappropriate times. This looks very socially awkward to other girls, especially same-age female peers. They might have difficulty just picking up on those kind of typical social cues or those social nuances, just like you were talking about. At times, their behaviors can look really bossy. Again, if I'm jumping into a conversation in an inappropriate way, it's going to look really bossy to another friend. And so girls with ADHD can have difficulty maintaining and keeping those friendships. Similarly, girls with inattentive ADHD, they tend to get missed by peers, right? They might be, again, daydreaming in their own thoughts, and so they might just be missed by their same age peers. The best thing that you can do for your child with ADHD, whether they're girls or they're boys, is to really help them find their environment. And we're going to talk about how to really engineer a better environment for our children with ADHD, but help them find their people, help them find a loving and supportive environment that other peers are going to really see their strengths come through.
And definitely certain structured activities and extracurriculars, those are places that kids with ADHD really can thrive, especially when it addresses that social piece of the picture.
Yeah, and I think it's really important as well to think about the fact that our kids with ADHD will tend to have other comorbidities. Comorbidities is simply a fancy word for having more than one mental health diagnosis at a time. And so we see different comorbidities present with different genders of kids with ADHD. So what are the typical comorbidities we typically see with children or boys with ADHD?
Sure. So kids with ADHD are just, in general, more likely to have a comorbidity, as Jill said. That goes for boys and for girls. Roughly half of all people, children and adults, who are diagnosed with ADHD will also meet criteria for another mental health or learning disorder. For the broad spectrum, boys and girls, that can look like really any learning disorder, maybe reading or writing. It also may look like anxiety or mood disorders, really runs the gamut in terms of other comorbidities. I think what's important to understand is that there really is a difference in some of this jargon between a true comorbidity, a true comorbid diagnosis, and what's called a secondary diagnosis. So a true comorbid condition, right, is another condition that is pervasive, it's chronic, it's across multiple settings for a child, it's occurring from early childhood all the way through the lifespan. It truly is its own separate diagnosis that child is experiencing. A secondary diagnosis, which we often see with kids with ADHD, is another diagnosis, such as anxiety, that develops as a result of the original ADHD symptoms. So the difference here is that when it's a secondary diagnosis, when a child maybe is experiencing some anxiety in the classroom setting that's impairing, but comes from their realization that they're having these symptoms of ADHD and they're impacting how they're doing in the classroom, this tends to dissipate when we give children proper treatment and intervention for those original ADHD symptoms. So it tends to be more in one context and more time limited. It's something that we can actually intervene on.
Yeah, it's so true. And females in general are much more likely to receive a diagnosis of anxiety or depression in their lifespan. Girls with ADHD are no different. So we do tend to see a higher likelihood of anxiety and mood symptoms for our girls with ADHD. What happens here is that girls are often internalizing their negative experiences with their ADHD symptoms. And especially when it goes undiagnosed, what we see is that undiagnosed ADHD and those symptoms For girls, they tend to actually think about these as really uncontrollable character flaws, and that ultimately will hurt their self-esteem, and it'll put them at a higher risk for developing those comorbid anxiety and mood symptoms. What's important to remember here, just as Meg was saying, is that these symptoms are typically secondary to their primary ADHD diagnosis. However, it really may impact the way that we treat our kids with ADHD. We may introduce a course of cognitive behavioral therapy, or CBT, which is an evidence-based treatment for children ages 7 and up, for kids that have trouble with, anxiety symptoms, mood symptoms. It helps them to address, problem-solving skills, positive coping thoughts for their negative cognition. So girls and boys with ADHD and comorbid anxiety or mood disorders, we would likely also add that on as part of their treatment.
Which is different, right? So it's different than how we think about the treatment of ADHD in isolation.
Exactly.
So when it comes to the treatment of ADHD in isolation, we typically are not building that piece in until maybe later on. Really, the focus of treatment is behavioral intervention in the classroom, at home, in the settings where a child is exhibiting the symptoms, really giving parents and teachers a lot of coaching around how to engineer a better environment, make the environment really respond in a positive way to the child so that their symptoms are less apparent. And also at times for children who are over the age of 6, we may be introducing medication as well to address the core symptoms, the biology of ADHD.
Exactly. So we want to talk now about some kind of key takeaways that you guys can think about when kind of wrapping up and thinking about the takeaways from this discussion.
So the first one, really, I think the primary one for me when I think about takeaways, what I want you to get out of this discussion, is really that early intervention and early diagnosis are key here for boys and for girls. So particularly for girls who we know have gone a long time being diagnosed much later in life, we really want parents and teachers to have a good understanding of the symptoms and try to be catching this early so that kids can really understand where their difficulties are coming from and know that it's not their fault. And so what this means for parents is that even if a teacher hasn't brought to your attention that your daughter is experiencing these symptoms in the classroom, if you're noticing them, particularly if there's a family history of ADHD, it's really important to go ahead and go through an evaluation process to see if your child meets criteria for ADHD and needs some form of intervention.
And when you're doing this, you just want to make sure that you're finding a professional that knows how to treat and diagnose ADHD. And so we do that in a number of different ways, but really a structured diagnostic assessment is the best way to go first and foremost if you have those concerns.
And that should really include, a provider should really be using a combination of reading scales. Collateral contact with the school is really important because ADHD symptoms should be occurring across multiple settings. And obviously a real structured life history with you as the parent to get a full history of how those symptoms have presented over time.
Exactly. We also want to have these conversations with our kids. Once we actually recognize and diagnose ADHD, talk to your child about it. I know for me, every time we bring this up to a child and we talk about and actually identify the symptoms of ADHD, there's a sense of relief. It's like, whew, these symptoms aren't my fault. And so when you give something a name, it makes a child feel like they have a little bit more control. And it also helps to just break the stigma of ADHD. This is incredibly common, and we want to, give our kids, let our kids know that we're here supporting them and that they really have a team around them.
Yeah. And I think one piece that we've already touched on, but that's really important, is this piece about making sure that we're constantly engineering appropriate environments for children with ADHD. And by engineering, what I really think of is that we are coaching the adults around a child to provide a really supportive environment for them, to recognize their strengths, to give a lot of positive feedback, and to really make the environment feel like a positive place to be for that child. It also might mean choosing environments or extracurricular activities, for example, that are a really good fit for your child's interests and where you know that they're going to be successful.
Exactly. And as we talked about before, kids with ADHD tend to have lower self-esteem. And so we want to work to encourage their self-esteem and boost their self-esteem whenever we can. We want to teach them that their brain might work a little bit differently, but that's not necessarily a bad thing. ADHD can make them really special and unique, and we have to help them to find those strengths and to really encourage those strengths. It's also important to recognize that ADHD is typically a hidden disorder. And so, as a caregiver for somebody with ADHD, you want to make sure that you're seeking support when you need it, reaching out to friends and family, asking for help if you need it, seeking the support of a mental health professional if you can as well.
Absolutely.
Awesome. I don't think so. Thank you so much for joining us today for a discussion on the gender differences in ADHD.